Dr. Bob Newhaven here of Northwest Indiana Chiropractic. Hope everybody's doing great today. Today we're going to talk about wrist mobility and how a lack of wrist mobility oftentimes leads to pain in the wrist. It can lead to different kinds of elbow issues like a tennis elbow or a golfer's elbow, and it can also lead to various shoulder issues, particularly in overhead sports like throwing and CrossFit. It can lead to different shoulder impingements and all kinds of not fun stuff. And so I have my assistant Amanda here that's going to help me demonstrate some wrist mobility issues. Come on over. So first I'm going to have you face that way. What I'm going to have her do is come into, in CrossFit and lifting, what's called the front rack position. So she's going to be elbows up and wrists up like so. And what we're going to do here is just check her range of motion in her wrists. And I want you to go as far as you can. And you can see on this side, her wrist is nice and flat for the most part. Her fingers are a little bent. And in this wrist, she is angled up a little bit, so she's not flat. What we want to see here is a 90-degree bend in the forearm and the wrist, or the fingers and the hands sit flat. Anything less than that is not normal. So, and this is unloaded. Now, when we add weight or we do something on the ground, when you add load or demand, this can decrease even further what is actually the usable range. And so what I'm going to have her do now is go on all fours. And I'm going to start her back in like a little child's pose. And what we're going to do is I'm going to have you rock forward. And she'll go as far as she can before she has to cheat. So as far as her wrists can bend. And you see she gets pretty close to 90 here, maybe slightly less. And what we want to see, again, is at the very least this, but preferably I would like to see her go. She's got a little bit better, but it's not normal, and she's probably feeling a little bit of a stretch here. Some people may even get pain here. So if you exceed what the muscles and the ligaments in the joint allows, a lot of people will get pinching or pain here. And so now we're going to also check the reverse way. So I want you to reverse your wrists and start in front of them. So start forward, and then what we'll have people do is rock backwards, and you can see already she's turning this wrist out because she doesn't have the range in the soft tissues, the muscles. And again, I want to see the same thing here. So you see she can just get to parallel, but if you can see in me, when I do it, I have much more than that. And so this is ideal and optimal, particularly when you are throwing a baseball, or you are lifting something, or you're doing anything on the ground. So as we're developing, if you can see on the poster when we're crawling, so as a baby crawls, one hand stays on the ground as the other one comes forward. And we use at least 90 degrees a lot of times, and sometimes even more. And if you don't have this, again, it can cause all different kinds of issues, from wrist, elbow, shoulder, even a lot of times up into the neck. I'll see people, particularly who lift, who if they can't get their wrist back, they'll jump their neck out as a compensation for that. And so if you find that you're definitely limited in this test, that's a big problem. But even so, if you think you're good here, check these couple other tests. And if you're having some issues, feel free to give us a call and come in, and we can definitely help you work through those. Dr. Bob Newhaven and my awesome assistant Amanda, Northwest Indiana Chiropractic.